back to a brand new series of Inside the Box. In support of National Wellness Month, I am launching the series with physiotherapist and rehabilitation expert Jon Kim. Welcome, Jon. It's really wonderful to have you here today.
Thanks, Joanna. I'm super excited and honored to be here. Happy to spread some of my knowledge.
Well, we're happy to have you here. I would like to start off with your origin story. How did you get into physiotherapy?
So that's a good question. So I think for me, it kind of starts with my undergrad journey. So coming out of high school, I honestly had no idea what I wanted to do, but being from a classic Asian family, I went into the sciences, maybe with the intent of applying to med school or dental school. I honestly didn't know. That was kind of my thought process with that, is just go towards one of those degrees. But within my first 2 years of doing sciences, I quickly realized it wasn't for me. I wasn't really happy. I wasn't inspired. And I just felt kind of unfulfilled. So I took a step back and really self-reflected on what kind of drove me, what I was passionate about. And one kind of constant in my life up until that point was physical activity and exercise. So physical activity and exercise for me was always something that kind of brought me joy and happiness. I love moving around, love going to the gym. So having come upon that realization, I switched focuses and changed my degree to kinesiology. So kinesiology is the study of the human body and movement. So I did 2 years at Langara and then flip-flop, came back to UBC where I finished my undergrad degree in kinesiology. Along the way, I did some personal training as well. And that's where I found my love for kind of one-on-one care, being in that one-on-one environment where you're really there to help a person, another human being, be the best version of themselves possible. So for myself, like physical therapy was never something that I dreamed of doing or I planned years in advance. It was more something that I kind of just fell into. So it was more of a natural kind of continuation of kinesiology. It could broaden kind of my scope of practice in terms of what I was used to in personal training. So I applied to UBC Physio, luckily got in, and then the rest is history.
That's amazing. Well, we're happy that you became a physiotherapist. So, what exactly is physiotherapy and what do you do?
So physiotherapy is an allied health profession. We work to help improve people's physical functioning as well as their physical well-being. So physiotherapy is quite a diverse field. We have physios that work both in the public and private systems. So public system being hospitals, private system being privately owned clinics. So myself, I work in a private clinic called Myodetox Kitsilano, where I focus, and our clinic in general focuses on private orthopedics. So we deal with your more typical musculoskeletal injuries, such as muscle strains, joint and ligament sprains, and overuse repetitive strain injuries. But at Myodetox, where I think what kind of differentiates us a bit from other physio clinics is we don't just focus on kind of healing people who are in acute or chronic pain, but we also look to promote longevity. One of Myodetox's taglines is future-proof your body. So on that end, you don't have to be in pain necessarily to come to Myodetox. We really strive on being proactive with physical health and functioning. So in that sense, we'll do an assessment, we'll do a postural scan, see if there's areas that lack range of motion or areas that need strengthening, so you can be proactive about it and hopefully prevent or mitigate the risk of injury in the future. You can't always eliminate 100% the risk of injury. There's always going to be a risk, but I think you can mitigate and manage that risk to some degree using manual therapy, exercise, and education. So for myself, I kind of use those three things, exercise, education, and manual therapy, to help my clients achieve their goals, whether that goal is to just do a squat pain-free, or whether it's to run a half marathon. I'm really going to be there as more of a guide to kind of help you along your unique path, your unique journey. And I really value building rapport, getting to know you as a person. One, because it makes it more fun, and two, I feel like it makes our sessions that much more impactful when we have that connection. And it's more of a back and forth rather than me just telling you what to do. I'm there to, again, like I said, be a guide.
Absolutely. And I can definitely attest to that, being your client. So I was also wondering, why did you choose Myodetox?
So that's also a really good question. So I think it goes back to actually before physio school. So I actually went out to Toronto to take I believe it was 4 or 5 day course with Vin Pham, who you know from undergrad, but he's the founder of Myodetox. And spending that week there, learning from him, learning kind of his approach and kind of what Myodetox valued, really inspired me. And I kind of kept Myodetox in the back of my mind as I kind of went along my journey in physio school, and applied after school. Thankfully got hired and couldn't be happier. So the reason why I was attracted and drawn to Myodetox is they're a very value-centered company. They focus on doing things right, doing things well, treating people with respect, treating not just us, but our clients as human beings, really focusing on one-on-one treatment sessions. So we really get to know our clients as people and not just an injury, which I find unfortunately can be common in kind of older factory style clinics where you go in there, physio only sees you for 15 minutes out of the hour that you're there. You're slapped onto some machine, um, and you're not given that one-on-one attention, that individualized care, which I think we really excel at. Nothing wrong with practicing that factory style or going there if that's what you value and you appreciate, but it's just not what I value and what I really like.
Absolutely. And that being said, having been treated by Myodetox, I would say that that philosophy runs true. So I was wondering about manual therapy. What is it and how can one benefit from it?
Mm-hmm. So manual therapy is kind of an umbrella term for a variety of techniques. So it includes techniques that work on your soft tissues, so working on releasing fascia, doing trigger point release to relax a muscle. It also includes techniques that work more on the joint, so joint mobilizations or manipulations. Or I kind of view manual therapy as any point in time where my hands are on that client. So using manual therapy to help someone through an exercise to reach a range of motion that they couldn't access before, I also view that as manual therapy. So what you call it kind of mobilizations with movement or assisted exercises. So the reason why we use manual therapy is several reasons. One is to decrease pain. So it helps to kind of desensitize your nervous system, helps to decrease the amount of pain that you're experiencing. Another reason why we use it is to create space in the body. So decrease tension where there might be tension. Opening that up then allows you to move better and access new ranges of motion that you may not have had previously. And manual therapy can also help to activate certain muscles in case you need strengthening. If you have a weak muscle, you don't even know how to use it or activate it, manual therapy can help you essentially turn on that muscle.
That's interesting. Thank you for sharing that.
Mhm.
I was wondering, speaking of activity, what are the benefits of keeping an active lifestyle?
Yeah, so having a active lifestyle is very important in my eyes. There's a lot of benefits. So if you look into the research evidence, there's literally thousands of studies that promote exercise, physical activity, in helping to improve mental health, physical health, and also reducing the risk of a lot of chronic conditions such as diabetes, cancer, and strokes. So a lot of people think having an active lifestyle means you have to go to the gym, you have to go become a runner. But in my eyes, that's not necessarily the case. It can be as simple as just going for a 15-20 minute walk every day. So one person's activity routine is going to be different from the next person. Like, so for myself, I'm fairly active, but there's going to be people who do way more than me. There's going to be people who do a little bit less. So if we're going by kind of guidelines, I believe the government of Canada, they recommend doing 150 minutes of moderate physical activity within a week. So moderate physical activity includes walking. So if you're someone who just is super sedentary, even walking for 15-20 minutes a day can make a big change, big improvement in both your physical and mental well-being.
Absolutely, and I can definitely attest to that. So, that being said, why would musicians benefit from physio, especially at Myodetox? And what are the common injuries amongst musicians?
Yeah, so that's a good question. So musicians would benefit greatly from physical therapy because music is quite physical. So yourself, you're a violinist. So when you're playing, you're using your arms, your wrists, your hands a lot, your fingers as well. But as a musician, regardless of what instrument you play, a lot of time you're holding these prolonged asymmetrical postures for up to hours on end, either when you're playing in a concert or when you're practicing. So that kind of segues into some of the common injuries that we see amongst musicians. So with musicians, unless you injure yourself outside of playing music, you don't really get what we call acute injuries like muscle strains, joints sprains, stuff like that. We get more what we call repetitive strain or overuse injuries. So these don't just happen overnight. They tend to build up over a longer period of time. So it could be months, it could be years, it could be even decades. You could go your whole life practicing music, playing music, not getting any pain, and then wake up one morning having some pain. So repetitive strain overuse injuries include things like repetitive neck or shoulder strain. So you might feel pain when you're in that position in the muscles themselves. You can get tendon issues, so you could get tendinopathies in the wrist, the elbow. You can get carpal tunnel, so this will typically involve more of the nerve. There's a compression of the nerve in the wrist, so you might get some numbness, tingling, pins and needles in the hands and fingers. If it's the neck, you can get kind of shooting pain, numbness, tingling down the arm. So these are all examples of repetitive strain overuse injuries. If you are experiencing kind of any of what I talked about, I think it is important to go see a healthcare professional, whether that's a physio, RMT, or chiro, to get that assessed to see what can be done. So if you go to a clinic like Myodetox, we typically do a full body assessment. And I think this is what kind of sets us apart from other physio clinics is we tend not to just look at the area in pain, because typically the area that's in pain isn't always the cause. It's sometimes just the symptom and kind of the victim of like a biomechanical issue or breakdown somewhere else. So for example, a lot of neck issues, we don't just treat the neck. We're going to have to look at the shoulder, look at the mid and upper back as well. So that's a bit more of a, I guess, integrative or holistic approach at Myodetox. Like, yes, you need to address the area in pain, but you also need to look beyond that, look past that. So you don't just treat, put a Band-Aid on it, decrease pain, and then it comes back in like a week. You want to, again, talking about longevity, future-proof your body, be proactive, and change your movement habits, your movement patterns, so this issue goes away for hopefully forever.
Absolutely. That's incredibly significant, especially for musicians, right?
Mm-hmm.
So, would you say you have any tips to prevent or manage these said injuries?
Yeah, so like we talked about with musicians in particular, where you're typically holding these prolonged postures for hours on end, one simple tip that you can easily fit into your day that can help a lot to alleviate any of that prolonged stress or pain from holding those postures is to break up the time that you're in those postures. So break up that time that you're practicing. I know when we first met, when I was first assessing you, you said you would practice upwards of 10 hours a day, sometimes 4 hours or longer consecutively in a row. So if that's kind of like your normal practice routine, one simple thing you can do is just to slot in little movement breaks every half hour, 40 minutes, or even every hour. So breaking up your practice into manageable chunks rather than one big chunk where you're just holding that position and not moving at all. So I recommend typically both for musicians and also desk workers as well, because desk workers tend to get similar issues, is to take a 1 or 2 minute break every half hour. I know sometimes it's easy to get caught up in whatever you're practicing, whatever you're working on. So I typically recommend even setting a reminder or timer on your cell phone just to have that kind of physical cue to, all right, I need to take a break, give my body a bit of a rest. And then you could either just walk around a bit or do a set of stretches, do a set of strengthening exercises if that's what your physio determines that you need.
Absolutely. And I could definitely say that I have experienced tremendous benefits from doing those things and incorporating it into my lifestyle. So, are there any exercises that you would recommend to the audience?
So yeah, there's actually several exercises that I would recommend. So I believe I'll demonstrate two. One will be a stretch for your neck, and the other will be a mobility drill to open up some space and improve some movement through your mid and upper back. Both these exercises you can do from a seated position. So these will be good to slot in during those movement breaks I recommended while you're practicing or sitting at your desk. That being said, if you're in pain or if you have issues, I do recommend getting assessed by a healthcare professional in the rehabilitative field. So whether that's a physiotherapist, RMT, chiropractor, osteopath, sometimes you have two issues that present very similarly, but the root cause is very different. So it's important to know what's driving your pain, driving that issue before we prescribe the exercise. Because you could have two people that present very similarly, but they may respond very differently to the same exercise. And in some cases, that exercise might even make the issue worse. So it's very important to know what exactly we're dealing with when we prescribe an exercise. Sometimes things don't need to be stretched. Sometimes instead, they need to be strengthened. So sometimes stretching can make it worse. Sometimes it can make it better. So it's important to know the difference between the two. So that being said, feel free to try these exercises yourself, but if you do feel any increase in pain, it's important to stop and not push any further into these exercises.
Absolutely. And I could definitely attest to that.
So I've actually got a question for you, Joanna. So we're flipping the script a little bit here, but I've been your physiotherapist now for about a month and a half. And I was just curious about how your experience has been over that period of time.
Well, John, to put it in one sentence, I would say my experience has been life-changing.
Okay, that's very, very powerful stuff. Can you elaborate on that a little bit?
Absolutely. So when I first appeared at your clinic, I wasn't pain-free. I would say every movement had a bit of pain, and it had increased significantly, especially since I felt there was a lot of overuse and also repetitive strain in my movements, and not being able to manage or determine the pain factor. That was my biggest problem, because quite frankly, I do like to push myself, as you can tell.
Yeah, and how long have you been living with pain for before you came to see me?
Well, it got worse, I would say, especially after the first wave of the pandemic. So after the lockdown, I would say it got increasingly worse because I had to definitely go back and forth to school to practice, and I had to allocate my hours wisely so that I would in my mind, allocating it wisely would be to practice it for the full session that I had the school booked for, right? Because you need to use the hours that are given to you, unfortunately. But I think it was really important for me to step back, assess the situation, and, you know, that was my investment in myself to future proof my body and to learn pain management, which is incredible because when you learn about your body and you learn how to manage it, you end up surprising even yourself, and your body heals eventually. And I would say it's good for longevity.
Yeah, no, 100%. And just seeing kind of the change, even within this short period of time, within you has been really inspiring. And honestly, is the reason why I do what I do and why I love doing what I do is to see kind of you being empowered and taking control, taking charge of your health and your body. I know we talked before about you having had experience with other physio clinics. I was just curious how your time with me and at Myodetox has been a bit different.
Well, John, I would say I've had a lot of physio. I would say I've started roughly around when I was 17, and that was because I was in a motor vehicle accident, and I felt that going to different physiotherapy clinics, especially sports injury clinic and just normal physio, I would say it felt like a factory. It wasn't very personalized. It felt kind of like they just wanted to fix the problem, like put a band-aid on it and then strap you onto a machine such as a TENS machine or a heat pad. And you do get the 15 minutes of manipulation technique or whatever manual therapy that they offer, right? But I would say it wasn't enough for me to learn how to control the pain in my body. And I would sort of, push myself to get better on my own without knowing the proper technique. But with Myodetox, they give you the tools. It's like that proverb. So a man gives his boy a fish he eats for a day. A man teaches his boy how to fish, he feeds the world. And I think that's a really important factor in your clinic that I took away at the very least.
That is a very powerful statement to kind of wrap this all up. And I think it exemplifies how I like to approach my practice and kind of my personal philosophy with physio is I really like to be there as a guide to educate and to help my clients really help themselves in a sense, to fix themselves, to give them the tools. So I'm there if they need me, but you don't need to rely on me going forward. You get to be better at relying on yourself. And so I'm super happy to hear that coming from you. You've definitely like put in the work, both in the clinic and outside. And I think it shows in just your demeanor and it shows in how you're moving as well. And to see you being empowered like that is a good reminder of why I do what I do and why I love doing what I do. But yeah, thank you.
Well, thank you, John, for teaching me the tools and for joining us today. It was an absolute pleasure to have you on my show. And for everyone who has been watching, thank you for joining us. After this, we do have a few exercises of John demonstrating, and it will help you prevent or manage your injuries. So enjoy. Don't forget to check out his clinic at Myodetox Kitsilano. Please hit the like button, subscribe, and hit that notification bell. Until next time, take care.
So this exercise is a stretch for your neck. We're going to hold for about 30 seconds, and it's very important to not push into any pain. So if you feel pain at all at any point, don't do this exercise. So I'm going to grab onto my head, pulling my ear down to my shoulder. You should feel a stretch
along this side here, and we're gonna hold for about 30 seconds. After that, we can change the angle of the stretch, hitting different muscles by turning our head to look down at our opposite armpit. And again, I'm using my hand to pull myself deeper into the stretch, holding for 30 seconds. And perform on both sides. So this exercise is the seated cat-cow. We're doing it to help promote and open up mobility in the mid and upper back. Again, very important, if you feel pain at any point during the exercise, don't continue with the exercise. So what we're gonna do is we're gonna open our chest up to the ceiling, bring the head back, and then we're reversing that movement, folding forward, rounding our upper back, coming down as far as we can, opening up the chest. You can imagine there's a string attached to your chest pulling you up to the ceiling and going back and forth. So we're going to do that for 10 repetitions and repeat 2 times.